Good morning. I'm Dr. Pondy. My nurse tells me that you're coming in today because you've been having some headaches.
Yes, I've been getting headaches every day for the past couple of weeks. I got some medicine that I've been using every night since the last time I was here. It hasn't been working though.
I'm sorry to hear that. Tell me more.
It's on the side of my head and behind both of my eyes. I've been getting them a lot, mostly when I'm stressed. I need to lie down alone when they happen. I haven't been able to do much lately either. I just don't feel like seeing my friends, or even going outside. I just don't have the energy anymore.
That sounds like it's really affecting your life. How long have you been feeling like this?
The past 3 weeks. The doctor and you continue to have a conversation.
I'm so glad that you came in today for a visit to talk more about these concerns. It sounds like besides the headaches, you've been having some stress and decreased energy. For many people, physical symptoms like headaches are connected to having stress and concerns that are going on in your mind. So here in this clinic, we work as a team. On the team is a behavioral health consultant who can talk to you more about what's been going on and discuss some strategies to deal with things. Would it be okay if I asked them to come in here and talk to you more about what's going on?
Sure. While you're waiting, the doctor and the behavioral health consultant have a conversation.
Hello, my name is Dr. Smith, and I am part of the Behavioral Health Consultation Team. First, let me tell you a little bit about who we are and what we do. My team sees many patients in the clinic to talk about feeling stressed, worried, or down, and how it's affecting your life. We talk together for 15 to 20 minutes, and after our visit, we will share this information with the doctors and nurses in clinic to be able to together give you the best care that we can. I will also put a note in your chart, again, to help communicate to the doctors and nurses involved in your care. If you ever have any questions about that, feel free to ask. I work as part of a team with other psychologists and social workers, so if you are back seeing your provider on another day, you can ask to see whoever is here on my team as well. We are all happy to talk with you. You can set separate appointments with the behavioral health team too. So today I'd like to learn more about areas of difficulty and what's going well, so together we can come up with a plan. Do you have any questions before we get started today?
No.
Okay. Again, if you have any questions, feel free to ask them. Tell me more about what's been concerning you.
Well, things haven't been the best. I'm not sure what it is. I don't feel like doing much of anything lately. It's gotten worse. Some days I can barely get out of bed. My partner doesn't understand how I've been feeling at all. She wants to go out with our friends, but I feel like staying home. Leaving the house has been so hard. It takes a lot of energy. I've also been worrying a lot.
It sounds like you've been having a tough time. Have you been worried about anything in particular?
No, I worry about a lot of things that I didn't used to. My partner is always out. I think she might be seeing someone else. I'm worried that our dog is dying because he's eating less. I took him to the vet, and they said it was fine, but I still feel like something isn't right. Our neighbor's house was broken into last month. I worry that could be us. I hear things outside sometimes, and sometimes it keeps me up all night.
How often do you think about these things?
Every day, for almost a month. I try not to. I try to manage.
And the headaches have lasted that long as well?
Yeah. Maybe longer.
It really does sound like you have a great deal going on between the relationship issues, work stress, and even some fears related to your neighborhood. Sometimes in life, things seem to gang up on us in spurts, and this seems to be one of those times for you. The key is making sure you are taking care of yourself while you problem solve what you do with the specific issues. I'd like to talk with you about what you have been doing to take care of yourself.
The behavioral health consultant continues talking with the patient.
I have a few other suggestions I'd like you to try. I would suggest exercising a few times a week and see if that helps you feel better. Would that be something you'd want to try?
Sure.
Another thing that you can try is to plan your worry, which is better than your brain deciding on its own to worry when you're about to go to sleep. What do you think about doing some journaling about your relationship where you write down your worst fears and thoughts, and then after 15 minutes of this, setting it aside and moving on with your day?
Yeah, that might work.
I would also suggest bringing up some of these thoughts and fears with your spouse. I can also teach you a brief relaxation exercise that you can do when you're feeling upset. Would you like to go through this?
Yeah, I think I'd like to try that.
So I spoke with Dr. Smith. She said that you both went over a relaxation exercise, and you'll be coming back in 2 weeks to meet with her again and discuss how things are going.